Now we spoke about a lot of conditions which the person was basically born without a vagina or a good vagina. So you have to now surgically construct a vagina for the person, right? So there are two popular methods which you can use to do this. Okay, we have the McIndoe procedure, then we have the Williams Vulvovaginoplasty. Okay, these are actually two ways in which you can surgically create a vagina. So we're not actually showing how to do it, but let's just quickly have an overview for exam for study's sake. Okay, how these procedures are done. So McIndoe procedure, also known as the Abel-Doe or the McIndoe or the Bannister technique, and the Williams Vulvovaginoplasty are actually two different techniques, but you use them to create a neovagina. That's a new vagina, So it's typically performed for people that have conditions where you don't have proper development of the vagina, like the Mayer-Rokitansky-Küster-Hauser syndrome, So McIndoe procedure, this is a pictorial overview. Of course, I didn't bring a picture that is showing the vaginas and all of that because it will be banned for nudity, right? So it involves creating a space, that's a cavity, behind the bladder and the urethra anteriorly and the rectum posteriorly. So the space is now lined with the skin graft. Okay, usually the graft is taken from the buttocks. Do you understand? So procedure, careful dissection creates the new vaginal space. So a surgical mold or stent is covered with the skin graft. So the graft covered mold is now inserted into the new created cavity and held in place, okay, for about a week, so that you allow the graft to take. Okay, so Williams Vulvovaginoplasty. Now this one, it creates a pouch or short tube using the surrounding vulva and the perineal skin, allowing a deep dissection into the rectovesical space. Okay, so a U-shape, a horse-shaped incision is made on the perineum. That's the area between the vagina and the anus. So the vulva and the perineal skin margins are now mobilized, okay, and sutured, pushed in to make a pouch. You understand? So it's simpler, it's less invasive, it avoids deep dissection and risks associated with injury to the bladder or rectum. Does not require a skin graft.